Well, so we talk about the employer market. I'd like the two gentlemen introduce themselves first. So briefly introduce yourself, tell the people here who you are, what company, what does your company do, and if possible, share with the audience here adoption number of your product or services, if possible. Okay, go ahead.
Yeah, I'm Derek Newell. I'm the CEO of Jif, and Jif is not the peanut butter, obviously. I get that question all the time. But it's an enterprise health benefits platform. So what that means is we help employers connect all of this amazing innovation to their benefit design. Employers really struggle with, what are there, hundreds of companies in that room? An employer can't contract with a device company, let alone multiple device companies, a disease app or service. And so it's highly complex for them. So what we do is we contract with all of the suppliers, and we gather all their data into one platform, and we connect that to benefit design, which allows employers to lower premiums for people who show healthy behaviors. It allows them to give them rewards and create a whole bunch of advantages for them. We connect with, obviously, devices and wearables. We connect with food and nutrition applications. We connect with stress and resilience applications, pregnancy applications, diabetes applications. So the top concerns and productivity issues with self-insured employers is what we work with.
Great. Chris?
Hello, I'm Chris Gibson. I'm the Vice President of Marketing and Product Management for Human Scale. We're a global ergonomics furniture manufacturer based in New York, and we've been in business for about 34 years making products that make the workplace more healthy, more comfortable, everything from task seating to height adjustable desks to task lighting. We also have a healthcare business and an ergonomic consulting business. And what's really differentiated Human Scale from the other office furniture manufacturers in the world is that we've always been focused on the user and ergonomics and really health of the user and ensuring that they have a more comfortable and healthy and productive place to work.
Okay, great. Before we start this conversation, I can't see people here, but how many of you are interested in the employer market for health and wellness product? Raise your hand. Country, right panel. There's a lot of data about this market. I find this market very interesting, because if you see the numbers, 80% or higher number of large employers all have employee wellness programs. But from our consumer data, we actually see that only about 15 million employees today in the U.S. are active participants of corporate wellness programs. We're not talking about one-off kind of a health risk assessment or screening kind of a product once a year kind of thing. We're talking about continuous participating in a program to helping get rid of some of the bad habits and also improve health. Right? So there's a lot of, I think this is a point to, there's a lot of growth opportunity down there. The big news this year is Target giving their 300,000 employee each one of them a Fitbit Zip. If you go down to United Healthcare booth, they talk about their employee programs are giving this Fitbit to, or not Fitbit, but their own branded devices to the employees. So for the people here in the room to get some idea about this employee wellness program, I want to first ask each of you, provide one example or one notable trends you see that in the last year in this employee wellness marketplace.
So I'll say something controversial right away. The reason there's only 15 million people in those programs is because the programs suck, right? They're just terrible, right? I mean, consumers spend $135 billion on wellness programs. Employers spend $6 billion on wellness programs. This is exactly the problem, what you described. I'm going to give you the device that I want, and when you do what I want you to do, I'm going to give you the benefit that I want, right? That's a terrible user experience, right? What if I want an Apple Watch? What if I already have a Samsung smartwatch? What if I already have a Jawbone? So Jif is a platform that allows consumer choice. We partner with everything. An employer can say, I only want to spend $50 per employee, so I'm going to give a $50 credit. And then they go into the Jif store and they buy whatever device they want. And our consumers put more money into corporate wellness than our corporate wellness partners do. So if our corporate wellness partner spends $1 million, their employees will put $2 million in. And we get between 60 and 300% higher engagement. And then what we do is we give them a reward that says, if you do these things, here's all the options and reward are available to you. If I gave everybody in this room $1,000, every single person would spend it differently. What I want and what you want. Money's not the same value. It's different value for different people based on what you give them. So when you give them Run Reward and you give them one product, you get low engagement. You give them whatever they want, and you give them whatever they want, and you'll get great engagement, and you'll get great outcomes. And so the trend we see is an amazing consumer experience, amazing consumer growth in these products and services, $135 billion. Billions and billions of dollars being spent on wearables. And the corporate market is tiny, and nobody uses it, right? So the opportunity is to connect consumer, all of this beautiful consumer stuff with the benefit design, and let the consumer companies do the consumer thing, and the benefit corporate consultants do the corporate part.
So, Chris, what do you see last year?
Well, the trends we're seeing in the office space, so aside from the consistent design trends of course, moving to more open plan and flexible workspaces, from a health and wellness perspective, we're seeing a few trends of note, and one of those is that ergonomics is really becoming more, I guess, mainstream. So, I mean, if you look back 10, 15 years ago when we were talking a lot about ergonomics and ergonomic products that would help prevent injuries such as back strain, eye strain, carpal tunnel, it was an uphill climb, and now it's becoming much more mainstream. People are much more aware of the payback of ergonomics and ergonomics programs. And then the other trend that we're seeing significantly in the survey we do annually of interior designers and facilities managers every year, for the first time last year, they mentioned that a big trend is the integration of technology into office furniture and things in the workplace. And that's really why we're here at CES and what we're doing with OfficeIQ, which is integrating technology into the furniture to make it more intelligent and allow higher utilization of healthy products and make sure that you have a more active and intelligent workspace.
Mm-hmm. So Chris, let's drill down to your business a bit more. For all the great products you put together and also market to consumers and to the employers, what product features and the functions work especially well for people like me, working in the office all day, looking at computers and doing things like that? What type of feature you can convince the consumer to use it?
Well, what we've always tried to do at Human Scale is make products that are incredibly intuitive to use and highly functional and healthy, but make sure that they're designed in a way that the user doesn't have to think about using it. We don't believe you should have to train somebody on how to sit in a healthy way, that you should design a chair that just allows people to sit in a neutral posture, allows them freedom of movement throughout the day. And it's something that's just automatic that comes with the product. I mean, a lot of people in the office furniture industry have made products that are keep people very sedentary and still, and they've been more focused on style in the workplace instead of the employee in their health and wellness, and that's really what we've done throughout our entire existence. So as far as features and benefits, I mean, we're focused on things that help people stay active throughout the day. So products that allow freedom of movement, from height adjustable workstations to task chairs, task lighting, everything that really allows people to be more comfortable in their environment. And speaking of the healthcare trend you mentioned, or ergonomics trend I mentioned earlier, a big part of that is height adjustable workstations. And I'm sure everybody here has started to hear of standing desk and is interested in that. And I mean, we're the only furniture manufacturer at CES, and standing desks get a ton of interest, but that's a huge trend, and rightfully so. I mean, this year, interior designers are projected to specify in 40% of their jobs height adjustable workstations, and it was only 15% 3 years ago. So that's a big trend, and we want to facilitate that by making those products as easy to use as possible, because what good is that product if you never use it, or if you have a height adjustable table and you just remain seated all day? So we try to inject technology as well as good design into that to help increase utilization.
And how does the employer actually review the product you offer to consumers? How does it evaluate the return on investment of buying your products? Well,
there's a significant return on investment on ergonomic programs. I mean, there's the direct cost, of course, if an employee has an ergonomic injury, whether it's carpal tunnel or back pain, and they're, of course, away from work, and then you're paying whatever that premium is to address those injuries. So there's direct costs associated with ergonomics, and then, of course, there's a payback with mitigating or preventing those issues. But then there's the indirect cost. There's people that are gone from work for a significant amount of time, people that are presenteeism as well as absenteeism, where you may be in significant pain, so you're not nearly as productive or happy in the work you're doing. So there's a significant cost to that. And then there's also things that are harder to measure. So is someone really miserable in their job because of this pain they're experiencing? And so there's significant cost, and there's also significant payback to investing in ergonomic interventions, is what we call it, is that can be from 3 to 1 to 15 to 1 of the dollars that you actually put into the program. Because one ergonomic issue, if somebody's out for a significant amount of time, can be very costly for the company. So we not only try to mitigate that, but also try to improve productivity for organizations and for individuals.
Right. And Derek, you already mentioned about the free choices of devices is very important for your platform to support employees. What other features you can walk me through that can keep employee not healthy and well, but also boost productivity?
So we have a number of features that help us do that. First, we have a consumer. We recruited all of our designers for our technology from the consumer world. So first, it's easy to use. That's the most important thing. But our software personalizes, so it takes all the benefits and it personalizes each of the benefits. Lots of companies have 20, 30, 40 different benefits that people don't know that is available to them. And we gather data from a bunch of different sources, and we make recommendations. Like when you go onto Amazon and you buy something, it says other people bought this too, and it's getting better and better, and you're kind of freaked out by how good it is now, probably. But what we do is we recommend things to people. So we will be able to tell, either through a direct survey or some data that we get, that a person is under high stress, for instance, and we'll recommend a resilience or a stress reduction program to them. And we will also recommend pregnancy program, healthy baby programs, diabetes management programs, as well as fitness and nutrition programs. And so the way we help people be productive is to manage their health, right? That's a primary mechanism we do. We also have some tools that allow employers to engage employees in a very simple transaction that before was very complicated. So pulse surveys and some other stuff that we do where it used to take employees a long time to do it. Now they just do it on an app, and it takes them 30 seconds, what used to take them 3 minutes or 5 minutes. So both on the health and wellness side, and then simple technologies to get some data that they need.
And same question, like Chris, how does the employer evaluate the investment? How do they calculate ROI on your solution?
Yeah. So an employer already is spending money on all of these 30 or 40 programs that they have. Many of them are PEPM, so they charge per employee per month $1. If nobody uses it, that's great for the business, because for the business who's selling it to them because it's high profit. It's terrible for the employer. So the employer, what we allow them to do is, with a number of those, is to turn them into transactional models where they only pay the vendor through JIF when the service is used. So that saves them a ton of money, but we can also make sure that they get utilized at the appropriate percentage. The other one is they have a very, very complex contracting. If they have 20 or 30 vendors, they have complex contracting and administrative processes, and we eliminate all those. We do all the vendor management. We all do all the first line support. We take care of everything for the employer. So that saves them. We get the first one-to-one ROI just in administrative complexity. And then, again, it's hard to measure. There's productivity. There's potential claim savings. We don't claim them. But some employers believe that when an employee uses a telemedicine program, that costs them $50, but it saves them $150. Well, we can help an employer go from 1,000 telemedicine visits to 5,000 telemedicine visits. And if they believe that those are saving the money, we get attributed value because we increase the utilization. We've not had ROI be a barrier to buying JIF ever, so it's pretty easy to put the business case together. As well as in Qualcomm, for instance, we did a survey, and 80% of the employees said them giving JIF to their employees improved their loyalty and view of Qualcomm as a company.
Great. And Chris, this year at CES, you see a lot of devices become smarter because of software. And you mentioned about you also have an OfficeIQ software solution out there. Can you tell me a little bit about that, and regarding how important the software part is to a business, and how do you, the software definitely collects a lot of information, right? And the employees may be sensitive to what information the employer would get. How to balance that out?
Yeah, that's a great question. I mean, OfficeIQ is a system of sensors and software that we actually integrate into our furniture to help give the employees more motivation to utilize healthy products more effectively, and also give that information anonymously back to the organization so they can see more justification for their investment. And this is the reason that we came to CES for the first time last year, and the reason we're here again this year. And it's interesting because you spend 55% of your waking hours at work, you know, a lot of times in front of a computer, and potentially an uncomfortable environment. And there's a lot of companies here talking about, you know, health when you exercise and at home. And you know, we're the ones that are really focused on how do you make that environment more healthy in the workspace. And I think that's a critical amount of time that you spend there. So how do we address that appropriately? And what OfficeIQ and how it came about is about 4 or 5 years ago, we were getting into the sit-stand business, and we were seeing that it was becoming more popular, but utilization rates were low. They were still around the 20 to 25% range. And again, it comes back to that, why would you invest in something if nobody's actually using it to improve their health and wellness? So fortunately, about 1.5 years ago, we created a partnership with a software company based out of Detroit called Tome, and they had software and connectivity expertise, and of course we had furniture, office, and ergonomics expertise. And we came together to try to answer the questions that we always get from corporations when we're presenting something like the sit-stand tables, which is, how do I know my employees are actually going to use it? How do I know it's really going to have any definitive health benefit? How do I know it's going to potentially have any financial benefit? And what we've done is created a system that allows individuals to understand how much they're using something like a sit-stand table, and the incremental caloric expenditure associated with that. And then it also gives them the ability to create goals. It you know, triggers prompts so they understand, you know, what's the healthy pattern of sitting and standing throughout the day. We're not telling people to stand all day. We're certainly not telling them to sit all day, but there's that alternation that's much more healthy. And what OfficeIQ does, in addition to giving that information back to the individual, is communicate that anonymously to the organization in the aggregate, so they can see across their employee population how much that investment is being utilized, and then potentially long-term use that for things like wellness programs or incentives with potentially their insurers to really justify that expense, and it is more of an expense than standard, you know, basic furniture, on things that are more healthy for the user.
So in other words, your furniture will not detect, you know, I take 2-hour lunch break.
Yeah, well, I mean, that's part of it. There's occupancy as well, so it understands if an individual is at the desk. It doesn't know that it's Derek or you. It knows that someone's there, and it's only calculating. So you can't raise it and then walk away and then burn 100 calories. But you can set goals. You can say, I'd like to, you know, burn an additional 100 calories at work today, and it'll trigger reminders every 30 minutes or so based on your biometric information to make sure you reach those goals. Now, if you set an unrealistic goal and say, I'd like to burn 1,000 calories simply by standing at work today, it's going to tell you to go work out at the gym, but it still can certainly help with that incremental amount of calorie burn throughout the day. And it also does things like understand occupancy, so it can help with space planning and things of that nature as well.
I think just one comment on that. I think it's amazing because that kind of sensor technology embedded in the environment is a very innovative thing, and they say the average weight gain for the average American between 35 and 60 really equals about 7 almonds a day. Like if you took that 30 pounds of weight gain, divided it by 365 days by that many years, it's like eating 7 extra almonds. 7 extra almonds is 100 calories a day about.
Exactly,
So you stand, you burn an extra 100 calories, you can prevent. It's amazing what you can do with that.
See, that's exactly, you know, your platform product can do is, you know, bring that knowledge to consumers, saying that doing little things, making good choices that can improve the health, and also employer will be happy about, you know, productivity gains, right?
Yeah, and this isn't the entire answer. I mean, it's one piece. I mean, it's not going to replace, you know, you having a healthy diet or other things, but it's one significant piece because of the amount of time that we spend in the workplace. And you know, we believe it's something that's really important to make a more healthy and active work environment.
Derek, what's the engagement rate of the users on your platform? Do you have a number to share?
Yeah, absolutely. So it depends on the products. So we have 3 products. We have our Challenges product, which is, you know, connect your devices. We'll put you in social groups and teams, and you have fun, or you can compete. The daily active engagement on that is like three times a day. We get between 25 and 75% of a company to engage. So generally like 3 to 5x the industry average. And people engage every single day, multiple times a day. Then we have our incentives platform, which is you do all these healthy things, you make all these choices, you make these choices of vendors, All the vendors are integrated with us, and they send us what we call digital exhaust. And then we give them lower premiums, or we give them discounts on things. So lower premiums are part of our solution and incentives. And when we have an incentives platform, we'll get between 70 and 80% of the people engaged. And then we have a new product called Navigator, which Navigator is more of an HR hub. It's get all your benefits in one place. It has benefit cards in there. It has the pulse survey, so you don't have to have all these benefit cards come to you in the mail. You just log into the GIF app, and all your benefit cards for the company are already in there. So that approaches like 90 or 95%. So when they force a utility function in the app, of course, everybody downloads it, right?
Okay. So for many people in the audience that try to get into, sell to the enterprise employer market, what kind of recommendation or tips or advice can you give to the people here?
It's hard. So that's one thing.
Good luck.
If you don't know anything, you need to be an expert in your space. You really need to understand your product, which is step one, and most of the entrepreneurs in the room do. Step two is you really need to understand their environment. And I say that, and everybody goes, yeah, but everybody has a gadget that they go to an employer and says, have I got something for you? And they don't understand the complexity of the work environment, how hard it is to contract with vendors, how hard it is to get an extra FTE to manage implementation of things. And this is just an example. Activision Blizzard, which is another one of our companies, when we came in there, they had a partnership with Fitbit. They love wearables. And Fitbit sent them a pallet of Fitbits to their different offices. They had to physically hand them all out, and their legal department required them to collect all the information because that's a tax benefit. Right. So they had to write down in a spreadsheet every person's name, the serial number of the device they got, how much it was worth, and there was no copay. And we changed that system where we managed everything. So that's just an example. You really have to understand what's hard for them and how your solution fits into that. And you have to persevere. Another great thing is get a partnership with Towers or Mercer, the big health benefits consulting firms. Like we did, we got partnerships with both of them, and they'll help you if they believe in your product.
And Chris, what kind of advice or tips you can give to?
I mean, I agree with Derek. I think partnerships are critical. I mean, how we approach innovation in our organization is that we develop about 50% of our products in-house from our internal design studio, and then the other 50% we partner with either designers and or inventors or other organizations like our partners at Tome that we've worked together to develop OfficeIQ, because we've been able to develop things that even if we would have been able to do it on our own, we've been able to do it much faster. And a lot of the things we just didn't have the ability to do it on our own. So it's those partnerships with, I think, organizations that believe similar things that you believe, and that bring a different skill set to the table, and also collaborations and partnerships through your pilot programs, with the right people that want to learn, and get great information about where you're trying to go. I mean, for example, we're partnering with a healthcare insurance organization out of Washington called Premier on one of the pilot programs for OfficeIQ to help prove out that incentive model we were talking about earlier. So if companies are going to make that extra investment in things like sit stand or office furniture that helps promote activity in the workplace, how do you create an incentive around that? And it's a big investment. So I think it's choosing the right partners to develop products more quickly and better products for users, and also choosing the right partners through collaborations.
Okay. So perseverance and partnership.
Yes.
Okay, 1 minute left. So quickly, follow up some question. Enterprise market. What's the average sales length? You experience.
We've been selling this product for about 2.5 years, and we have about 25 customers. Our customers tend to be Fortune 500 customers, so our average customer size is 25,000 employees, so big corporations. And it ranges from 6 months to 24 months so far. Some people we've been working on almost the whole time. And I would say the average is 9 to 12.
Okay.
Contracting cycles, another 6.
Okay.
Our customers vary in size from Fortune 500 companies to small companies. We sell through retail and corporate, so it's a variety of size. But with OfficeIQ specifically, we have pilots with large financial institutions, pharmaceutical organizations, So a variety of organizations. I mean, everybody really needs what we do, or at least we hope so, to create a healthier work environment. So it really runs across the board.
Great. Thank you so much. And you know the expert here about the employer market. Talk to them and maybe partnership as well. Thank you very much.
Thank you.
Thank you.